Hi, I'm Dr. Stu. I'm a board certified family medicine and sports medicine doctor. In this video, we're going to discuss what are the heart symptoms that you should not ignore before starting to exercise. Without further ado, let's get started. So recently, in a recent video, I've discussed about heart attack during exercise, and sometimes the heart attacks can lead to a dangerous electrical abnormality of the heart called as the ventricular fibrillation, which can lead to death. However, timely CPR and timely shock can actually save patients' lives here. However, some people can develop a heart attack and they can end up going to the hospital with just chest pain, and they may need further evaluation treatment based on what they find. But anyway, recently I'm pretty sure that you have seen in news channels where there have been a lot of reports of people dying due to exercise. Unfortunately, sometimes we do see a heightened news coverage when people die from exercise, but there has been a lot of people who are dying from not performing regular exercise. However, the good news is that it's important to know that exercise can sometimes rarely induce heart attack or cardiac arrest or a sudden cardiac death during exercise, so that we can take the necessary precautions to prevent that from happening. So when you look at the past, it was normal that individuals would be used to engaging in regular walks and biking as part of the daily routine, and thereby they were having an active lifestyle. However, in today's society, many people have sedentary jobs, and that also includes me. This leads to contribution to a lack of physical fitness. In addition, the emergence of exercise programs like CrossFit, high intensity training, marathons. So sometimes the unfit individuals will suddenly get motivated to engage in strenuous activities that can lead to complications like heart attack and heart arrest. So it's always important to prioritize proper guidance and supervision when undertaking any physical activity to prevent complications like this. So in addition, you have to remember that there's been a huge spike in the supplement industry. So it is important to remember that the supplements are not FDA regulated. What that means is that the supplements can be released into the market without going through rigorous testing and practices. The FDA will come and take a look at the supplement only if there has been numerous complaints about the supplement. So what this means is that the pressure is on you to make sure that you get the right supplement. There has been a lot of studies that shows that independent testing of certain supplements, actually they have a lot of chemicals that are not listed, and most of these chemicals are usually stimulants or steroids. So we know that stimulants and steroids, a chronic exposure to that, can increase risk for heart damage and heart disease, right? So this particular supplement can actually increase risk for heart attack or heart disease during exercise. So that's why in this video I'm going to list out symptoms that you should be careful, so that let's say if you have these symptoms, I don't want you to panic. All I want to do is that I want to talk to your doctor so that the doctor actually takes a look at it. He might need to do further testing and evaluation before he can clear you from exercise, okay? So if you're someone who has diabetes or heart disease or kidney disease, then we have to assume that you might have a silent heart disease going on. So let us say if someone is exercising regularly, they have been doing a moderate intensity exercise and they've been doing a vigorous intensity exercise and they don't have any problems, then I'm not worried about it. But let's say if someone has been sedentary. So let us say if someone is sedentary and they found that the person has diabetes, or let's say the person has kidney disease or heart disease, then it is important to make sure that you discuss with the doctor before you start with exercise. Usually when someone starts with a moderate intensity exercise, which is basically kind of like a brisk walking or maybe like a light jogging or so, that usually is okay. But let us say if someone is going to start with vigorous intense exercise with underlying diabetes, heart disease or kidney disease and have not been exercised regularly, it's always important to make sure that you discuss with the doctor. Otherwise, a silent heart disease can manifest while you're exercising. So let us say if someone comes and tells me that they have been feeling short of breath while they're laying flat, but then they have to keep 2 or 3 extra pillows to keep themselves propped up a little bit, and thereby they do not have shortness of breath. This means that this person might likely have orthopnea, which is basically a symptom of a heart failure. So some people can have what we call as a paroxysmal nocturnal dyspnea, where people might get up in the middle of the night, maybe gasping for air, and after that the symptoms resolves. Again, this is a concern for a possible heart failure. So let us say if this person has these symptoms, let's say if I see this patient in the clinic, I'm probably going to get an EKG, I'm probably going to some blood work, I'm probably going to get an echo. But remember, even with heart failure, exercise is going to be helpful, but it's also important to make sure that they start to figure out what type of heart failure is this, what is the severity of the heart failure, so that they can prescribe you the exercise properly. So the other common symptom that I worry about is fainting. So I worry about even in athletes, even in middle-aged people, or even older people too. So a common symptom that comes from fainting is actually vasovagal syncope. So vasovagal syncope means that there is too much of parasympathetic stimulation. So basically what that means is that the heart rate drops, the blood pressure drops slowly, and usually people have what we call as a prodromal symptoms. So basically means that there's a little bit of dizziness, there's a little bit of like nausea sensation, things like that, and then they pass out. But let us say if someone passes out, I'm also worried about heart as a cause of passing out. So when I say heart as a cause, sometimes the heart can cause an electrical abnormality and thereby causing a sudden stoppage of the blood flow to the brain and thereby causing fainting. But however, the heart rhythm restores back to normal and thereby the person just starts back to his routine activities. But let us say the heart is the etiology, or heart is a cause for this fainting. It means that there's an underlying silent heart disease that is causing these symptoms, which needs further evaluation. So let us say if we don't take this seriously, then that person might go for exercise and the same electrical abnormality of the heart might happen, and this time this can lead to a complete heart arrest and the patient may not regain back his consciousness ever. So the next symptom that we're going to talk about is chest pain. So the chest pain can happen during exercise or without exercise. So let us say when the chest pain happens on and off without exercise, we call that as an unstable angina, and that needs further evaluation. But let us say the person does not have any chest pain at rest, but only happens during exercise, and this is what we call as a stable angina. What that means is that, so let us say if this is a blood vessel of the heart, and they can have an 80% blockage or something like that, but let us say when they exercise, they need more blood flow. When they need more blood flow, because of this blockage, they're not able to get enough oxygen because of the decreased blood flow, and thereby the lactic acid starts building up and thereby causing the chest pain. However, when they stop exercising, the chest pain goes away. Again, this is something that needs further evaluation because we may start them on medical management to stabilize the plug. It is very uncommon for someone to go do a cath on these stable angina because it doesn't change the long-term outcome. But still, it's important to make sure that the doctor knows it so that they can prescribe the exercise properly, thereby avoiding any bad side effects from the exercise. So the next symptom is high blood pressure. So we know that for high blood pressure, exercise is really important. However, when someone has an undiagnosed high blood pressure, I have no idea how high the blood pressure is, number one. So let us say if the blood pressure is like 170 or 100, and let's say they're doing a strenuous activity, that blood pressure might go up to like 200 or 110 or something like that. And again, in certain instances, that high blood pressure can increase the risk for stroke and things like that. So that's why it's important to make sure that the doctor knows about the undiagnosed high blood pressure. So this way, one, he can start your medications to get your blood pressure under control. And after that, you can start exercising regularly. And as you start exercising regularly, as you start to change your lifestyle and stuff, your blood pressure will start to get better, and thereby you can come off the medication slowly. So the next symptom is calf pain. So calf strain can happen sometimes when we're walking, when we are running, a strain happens. But this particular symptom is that, so let us say you're walking, and then they start developing an intense calf pain. So usually patients tell me that it feels like someone is pouring acid onto their calf muscles. And the moment they stop exercising, that pain gets better. And we call this a claudication pain. So when this is a symptom, we worry that they might have a blockage in their blood vessels that supplies the legs. We also know that, let's say if a person has a blockage in the legs, there's a high chance they're also having a blockage in the heart. So basically they might have a silent heart disease. So this is important to make sure that you discuss with the doctor because they might need further evaluation to make sure that they don't have a silent heart disease. So again, exercise is going to be really helpful for people with peripheral arterial disease, basically the blockage in the blood vessels. But still, it's important to make sure that the doctor helps to prescribe them exercise, thereby you don't overdo it and cause side effects from the exercise. So if someone has had COVID and then in addition they've had COVID complications like myocarditis, which is basically kind of like a muscle injury to the heart, or pericarditis, which is basically an injury to the covering of the heart, then we worry about complications that can come from exercise. So for example, that people can develop an electrical abnormality of the heart and thereby increase risk for sudden cardiac death or basically like a heart arrest and so forth. That's why it's important to make sure that you discuss with the doctor because depending on how bad the injury to the heart was, the doctor might be able to prescribe exercise in such a way that you don't develop a bad complication from exercise. However, let us say you've been hospitalized after COVID. I've seen a lot of people having a severe shortness of breath, and usually we recommend starting with a very low intensity exercise and gradually build up to moderate and vigorous intense exercise. However, if you're having severe shortness of breath or chest pain or had any complications from COVID, make sure that you involve your doctor so that he can help you prescribe exercise safely, and thereby you have a regular follow-ups to make sure that you're progressing well. So one thing I want to emphasize here is that the conditions that I've covered in this video, exercise is still the best medicine for all these conditions. The only thing that you need to have is a good partnership with your physician and other healthcare professionals so that you can perform the exercise safely. Okay? So remember, exercise improves cardiovascular fitness, and fitness matters. Fitness improves longevity. Okay? So in order to understand how exercise improves cardiovascular fitness and improves longevity, make sure that you check out this video here. And if you really enjoyed this video, if you found this video helpful, please make sure to hit the like button. And if you have any questions or comments, please post in the comment box below. And I'll see you in my next video. Until then, goodbye.